Assalamu alaikum and good evening, dear viewers. Welcome to a brand new episode of Harmony of Life. I'm Saleh along with my colleague and co-host Camille Janvier. Camille, good evening.
Good evening, Waleed, and good evening to everyone joining us this evening. Assalamu alaikum and welcome to another brand new edition and a new week with us on Harmony of Life. And this evening we have two very interesting and different topics. Our first topic this evening, we're going to be discussing fertility awareness with Dr. Ahmed Isa.
And later on in the program, we're going to be joined by the Italian ambassador, Dr. Mario. Both were talking to us about the Italian arts exhibition recently held in Riyadh.
But for now, we're going to go for a report looking at the tweets you've been sending us on laparoscopic gastric band surgery. So let's look at those tweets.
And those were the tweets that we've compiled on laparoscopic gastric banding, which is our Twitter topic for the Twitter segment we always start our show with. And now we are pleased to introduce our first guest for our first topic of the evening, which is fertility awareness. We have Dr. Ahmed Isa, a specialist of obstetrics and gynecology and IVF. Dr. Ahmed, welcome to the program.
Yes, well, thank you.
Dr. Ahmed, the topic is fertility awareness. We've covered fertility before on the program, but what is meant by fertility awareness?
Okay, first I would like just to express my pleasure to be here in just a worthy and valuable program. Before talking about fertility awareness in general, I would like just to justify the word fertility. Okay, in general, when we say fertile person, we refer this word to an adult person who has the ability for reproduction, which means his reproductive system is able to produce the gamete that carries the genetic or part of genetic material and transfer it to the offsprings, or maybe in the simpler expression, just the ability to have a baby. Okay, so regarding fertility awareness, it's the science of the knowledge that interfere or handling all the steps or realization of all the steps, biological steps related to the fertility. And unfortunately in our culture, Arabian or Eastern culture, we lack a lot for such kind of knowledge and information. Maybe it's something related to our culture or the way we have been raised up. I have, on this occasion, I have a very nice story about this. It's a nice experience have been done on, in Malaysia in the early 1990s, where Mahathir Mohamad, the Prime Minister of Malaysia, found the incidence of divorce, a very high instance of divorce in this part of his judge. So he just decided to put a plan for economical progress, and he found this is going to impact his plans a lot. So he just put an experiment he put a program or a course for every newly married couple or just planning to get married, just to go through. And they are not allowed even to get married unless they pass through an exam and have something like a license. It's like, like driving a car, you have to
know how to drive.
You have to drive, and what is the way you are going to drive through.
Yeah.
This amazing experiment reduces the percentage or the rates of divorce from 32 to up to 7% of within few years. So it was a tremendous effect. This may confirm the importance of such issue, of such a fertility awareness program for our newly married couples.
Mm-hmm.
So I think we have to apply something like this, just to not to give the way to a lot of ignorant people and a lot of rumors, just to deceive the couples and give them bad feedback about the infertility or fertility in general.
So basically, going back to the experiment in Malaysia, it was a course to make sure that nobody gets married before knowing their do's and don'ts.
Generally, it was in marriage as a general, but in particular, a certain issues about fertility lifestyle or how they should know about their fertility or this biological process in their life.
Okay.
Dr. Ahmed, there's obviously many different reasons for infertility. So, and we know that it's not just the man's fault or the woman's fault.
Definitely.
It's actually both sexes, and the causes of infertility range. So if you could give us some of the reasons that infertility is caused.
Okay, just to simplify the issue, causes infertility, we can just summarize it in 4 main topics, regardless the percentage of each one of them. Unfortunately, it's only just 1 for the male and 3 for the female. Despite this, the percentage of infertility in male and female are almost equal.
Yeah.
But the male is much easier just to check and to know if he has a problem or not, rather than the female, which is a bit much more complicated. So the male, we check one issue in the male, which we can consider two subjects in the male. The first is how potent is he? It's something obvious. If he's able to just perform a well relationship with his partner, and this easily to be known from the start. And the second part is the semen parameters he has, and it needs an investigation, just to simple investigations, just to note the semen parameter regarding count, motility, activity, and abnormal forms. So this is regarding the male, or the one cause of the male. The other 3 causes of the female related to each part of the female genital tract.
Yeah.
The first and most important one is the ovary. If anything relating to the ovulation or something impacting the chances of regular ovulation may impact the chances of having pregnancy, like decreased ovarian reserve, like polycystic ovary, anything may interfere with ovulation. Second thing is the uterus itself, where the embryo or the fertilized ova implants inside. If there is any problem with the uterus, like congenital anomaly, small uterus, septum inside, some benign tumors like fibroid, polyp may interfere with the implantation, and hence the chances of getting pregnant. And the third part for the female is the tubes, which is the way or the transport way for transporting the egg from the ovary to the uterus. So if any problem with the tube, like blockage, twisting, adhesions around from outside, may interfere with this transport, whether from sperm to the oocyte or from fertilized oocyte to the uterus. So those are the main 4 causes for the couple. 40% is for the male and 40% for the female. And the remaining 20% is divided between common things between both, or maybe what's called unexplained infertility, where is nothing obvious as the cause for infertility.
When do you consider, or how do you consider a couple as infertile?
Okay, this is a good question. First of all, just we'd like to know what is the chances of pregnancy for any couple. Let me ask you a tricky question. What do you think is the natural pregnancy rate for any normal couple per cycle? Okay, let me ask. Yes, if we assume just 100 couple of our relatives just married today.
Okay.
Okay, how many of them do suspect to have pregnancy from the first cycle.
Well, can I put it this way, doctor?
Yes.
I've heard it put this way, that pregnancy doesn't happen within the first couple of months, but if it doesn't happen after the first year of normal married relationships.
This is what's related to the definition of infertility. Yes.
Yes, then they would be considered infertile.
Yes. This is what exactly I was going to say. So for the cycle per se, the chance is about 20%. So if we assume the 100 married today, we are suspecting just 20 of them will conceive in the first cycle, okay, and 20 in the second, and so on. So within 1 year, statistically speaking, about 85% to 90% will conceive. So just 10 to 15% will have a problem of having a baby.
Past that first year.
Yes, after 1 year. Okay, so this is the definition of infertility. It's inability to conceive for 1 year after having a regular relation without using any contraception. Okay. So when we describe regular relation, we are talking about average type or average rate of relation. If we are assuming that a male is resident here in Riyadh and female and his wife is resident in Dammam or Khobar and just meet in the weekends, we cannot consider this a regular relation. So the chances of having a baby is a bit low. So in such way we cannot think in the same way like 1 year. So we have to consider regular relation, and in average it should be about twice a week at least, just to meet the possible time for the female to have the chances of ovulation and fertilization for the oocyte.
So doctor, what are the suggestions or advice that you can give for people if they want to have good fertility?
I think this is a question for all of us. I think all of us should change our lifestyle for the healthy pattern. We have to think about what elements in our life may affect our body in general. Because the most sensitive part in the body is the reproductive system, because it's regularly generating cells. So any problem with the environment around may interfere with this process. So we are talking about a healthy lifestyle in general, like healthy food. Try to avoid just junk and fast food. Definitely quitting smoking. Try not to gain a lot of weight. To follow like regular regimen for diet. Maybe just to play some sports, breathe fresh air. Just like putting ourselves in a healthy lifestyle, and try to avoid. This is the easy part we can follow, and there is the difficult part, which is related to the environment around, the pollution and the food we eat, the water we drink, and this is a bit inevitable.
So they all play a major role.
Definitely, sure. As I mentioned, the reproductive system is very sensitive to such changes in the environment.
All right, well let's go on a short report right now on our topic, and we'll be right back to continue with Dr. Ahmed Isa. Stay tuned.
Being a mom and having a family is what I've always wanted to do.
I thought, oh, easy, I'm gonna get pregnant like this.
I might be approaching the last good years of fertility.
It's a very human trait to want to have a child and see your genes in that child.
It was just emotionally too much for me to accept that I couldn't get pregnant on my own. I felt like something was taken from me.
We had tons of tests done. Why me? I mean, life's not fair.
I wanted to have kids, and I knew that being in a relationship with a woman wasn't going to stop me.
The doctor said, your hormone level is so low, you're not going to get pregnant naturally anymore.
It's a marathon for a lot of couples. There's attrition at every point of the process.
The odds were really in our favor because they couldn't find anything wrong with either of us at this point.
We did one IVF, it didn't work. Right away I said, let's do another one. And again it didn't work. Every time when my test was negative, it's devastating. It's devastating.
Women make a lot of decisions about their professional and personal goals in life based on a baby. But no one really told them that their eggs were different from sperm. They're going to run out of them.
The future is limitless.
The technologies are very promising and have come a long way in the last 30 years.
There's about 14,000 egg donors.
About a third of our surrogates become pregnant with twins.
It's just as likely for the man to be infertile as it is for the woman.
The price of the tests are likely to come down. There's a bright future ahead.
I would say we're probably responsible for 35,000 children out there.
Egg freezing has a potential to lead a social revolution.
I've done the maximum that I can do to try to improve my chances of having a baby in the future.
Best use of these technologies.
Welcome back, ladies and gentlemen. That was a report on infertility. And now with us to continue this discussion, we have Dr. Ahmed Mohammed Mohammed Isa with us. Welcome back, Dr. Ahmed. Doctor, before the break, of course, we're discussing infertility and the different reasons people are infertile. First of all, Doctor, if you could tell us, what are the options for people who suffer from this problem? What can they do about it?
Okay, how we can help them, you mean?
How can you help them?
Definitely. First of all, we just have to investigate the couple to know if there is a prominent reason, if there is something just to, it's like a thread for the way to go through, or just everything is okay and just we have multiple options to choose from them. Like I mentioned, the causes of infertility, there is another options to treat the infertile couple. This starts from nothing. If just the couple came for just check everything and everything is okay and just would like to wait more, and this is maybe suitable for the newly married couple with short infertility and probably for the young couples. So we can just give them more time to give the chance for natural conception. Okay, this is the first option. Second option, we can shift for the most simple one, which is follow-up ovulation and timing of intercourse, which is also suitable for the normal couples of unknown reason of delay of pregnancy and with short infertility, of course. And maybe it suits the couples that have improper timing for relation through the months or through the cycle. Like I mentioned before, maybe there is a big distance between them, just meeting everybody in the weekends. So just follow up the ovulation while doing like mild stimulation or ovulation induction to produce, to give a chance for more eggs to be produced, and make like a timing of the proper ovulation. We have only about a couple of days by the middle of the cycle, which has the best chance for fertilization and hence pregnancy. Third option is the IUI, which is called the IUI, or the intrauterine insemination, where we follow up ovulation, but at the time of ovulation, we take the semen sample and prepare it in the lab just to enhance the motility of the sperm, add some media to enhance the motility, and then inject them inside the uterus just to make the sperms more closer to the oocyte and increase the chances of fertilization. This may be suitable for some males who suffers from a problem with a proper relation with their partners, or maybe with the male who have a problem who has some problem with the semen parameters, like mild decrease in the count of the sperms, or some weakness of the sperm motility. This may help a bit, and of course it would be better to just use it in short time infertility. And the most major or the most advanced and sophisticated is IVF or XE, where we just stimulate the ovaries and pick up the oocyte to be fertilized in the lab, and then replace embryos when they start to cleave after 3 days, and put them inside the uterus just to get the best chance for pregnancy.
And now, concerning these options and these treatment plans, if a person if somebody is not able to conceive, if a couple is not able to conceive, after 1 year of trying, is that immediately a trigger to go seek medical advice, or when do you advise people to seek medical advice?
Like I mentioned before, the definition of infertility is inability to conceive up to 1 year. But this is a rule. Definitely there is an exception for such rule.
Yeah.
Unfortunately, in our days, nowadays, the age of marriage for females is getting increased. In the old days, we used to find female get married by the age of early 20s or even before. But unfortunately, right now, it's easy to find a female over 30 and even 35 did not marry yet. Okay, this is all interfere with her biological clock. The female has something which is called biological clock, which is a period which we call it the child-bearing period, which starts by the age of puberty till they have all her ovarian reserve or her bank of eggs faded out. It differs from a female to another. Some of them may have this age by the 45, some 40. Sometimes in a rare case we can find a female in 20s or 30s even who has their ovaries almost like an old one, which is called premature ovarian failure. Like their ovaries is getting older than their age. So we have to consider the age of the female, especially the female. If a married female is 20s, like not like the female in 35. So waiting for 1 year for a female after 35, just married after 35, is not wise enough. So the exception for the rule is if a female is more than 35, we have to think earlier, maybe after 6 months to start thinking about the infertility. There is a lot of other exceptions. The infertility, considering infertility after 1 year for every normal considerations about both of the couple. But if there is a prominent problem like the female having her cycle irregular, she has her cycle every 2 to 3 months, or she has previous major pelvic surgery, like removing myomita, like removing cyst or removing even one of the ovaries.
In that case, you seek
Yes, we have to seek earlier, yes, just to know the cause.
All right, well, Mr.
Well, sir, Dr. Ahmed Mohammed Amar Mohammed Isa, we'd like to thank you very much for being our guest this evening and shedding so much light on infertility and fertility awareness, actually. Wish we had more time, but unfortunately we're running out of time. But thank you very much for being with us once again. And now we're going to go for a report, after which we will be back to welcome our second guest. So stay tuned.